Welcome to the podcast. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is the space where healthcare, law, and real-life situations intersect. Each episode is designed to break down complex medical and legal topics in a way that's clear, accurate, and grounded in evidence, without fear, misinformation, or sensationalism. Whether you're a healthcare professional, attorney, gig worker, parent, or simply someone who wants better understanding of how medical events and legal responsibility overlap, you're in the right place. Let's get started. I once helped a family who received a $3,000 balance for a 2-hour emergency visit. They were stunned. They said they paid their copay, their insurance showed a small portion owed, and yet the hospital invoice listed a long string of charges that didn't match any paperwork they had. After a few calls, a code error and a duplicated facility charge were fixed, and the bill dropped by $2,000. That saved this family real money and weeks of stress. Today, I'm going to give you 3 concrete actions you can use the next time a bill arrives so you don't need to rely on luck to get the right result. You can act with confidence instead of confusion. What I'll teach you and why a nurse's perspective matters. I work with medical records every day. I read charts and bills, and I walk cases from the bedside to the billing office. That means I see the common mistakes and the practical fixes. Today's roadmap. First, how to read an itemized bill and an EOB in plain language. Second, exactly how to dispute and negotiate charges with scripts you can use. And third, preventive habits to avoid surprises. By the end of this episode, you'll have a short checklist you can screenshot or transcribe and use immediately. Section 1. Anatomy of a bill. Reading your EOB and surprise charges decoded. Let's start with the basics. An itemized hospital bill lists every charge: supplies, labs, imaging, room fees, medications, while your explanation of benefits, or EOB, is the insurer's summary that shows what they paid and what they think you owe. 2 quick flags to watch for right away: facility charges versus provider charges, and duplicated or unusually high line items. Facility charges come from the hospital or clinic and cover overhead, rooms, equipment, nursing. Provider charges come from doctors or specialists. Think the ER physician or radiologist. Sometimes the hospital bills the room, and a separate provider bills the doctor who read your imaging. That's normal. Surprise billing happens when one of those providers is out of network, even though the hospital is in network. Now, the codes. CPT codes describe the service, for example, a specific repair or a lab panel, and ICD codes explain the diagnosis. You don't need to memorize codes, but learn to spot mismatches. If your visit was for an ankle sprain and the bill lists a complex surgery CPT code, that's a red flag. On the EOB, look for allowed amount. That's what your insurer agreed to pay. Patient responsibility is what you owe after insurer adjustments. Adjustments, or contractual adjustments, are reductions the hospital applied because of their contract with the insurer. If you see a large balance that your EOB doesn't explain, request a detailed itemization from the billing office. Surprise charges often come from 1. An out-of-network physician billing separately, 2. Being placed under observation instead of admitted as an inpatient, which affects coverage, and 3. Clerical errors, like duplicated charges or wrong dates. A quick practical test. Match the dates and times from your medical record or discharge summary to the dates on the bill. If a charge appears before or after your visit, ask why. If a provider you never met appears, call the billing office and ask for an explanation and their credentialing information. These are simple checks that reveal many common errors. Section 2. How to dispute, step by step, and scripts for negotiation and assistance. Start with documentation. Gather the EOB, the itemized bill, your insurance policy summary or the relevant benefits page, and any discharge paperwork. Create a log with dates, names, and call notes. Call sequence matters. First, call your insurer to confirm what they paid and why a balance is shown. Second, call the provider or hospital billing department to ask for clarification and a corrected itemization. Third, escalate to the hospital's patient advocate or billing supervisor if you hit resistance. use these exact phone scripts. With the insurer, "Hello, my name is your name. I have an EOB for claim number. Can you explain the allowed amount and patient responsibility? I see a balance on my hospital bill that doesn't match this EOB. Can you confirm what was paid and why?" With the hospital billing office, "Hi, I'm calling about itemized bill account number. Can you walk me through each charge? I'd like a corrected itemized statement if there's a duplicate or date error. Also, could you send me the documentation that supports each billed procedure?" If a provider is out of network, please provide billing and credentialing records for the provider who billed this service. I want to understand why this provider was out of network and whether there was any option to receive care from an in-network clinician. These phrases are direct and keep the conversation professional. Documentation checklist to keep with every dispute. Account numbers, claim numbers, dates of service, names and titles of people you spoke with, reference or confirmation numbers, copies of EOBs and itemized bills, and any prior authorization or referral documentation if relevant. Send dispute requests in writing when possible. Email counts, but certified mail creates a paper trail. If you don't get resolution, ask your state insurance commissioner for guidance. Many states have consumer complaint portals for billing disputes. Negotiation and assistance. If the bill is correct but unaffordable, ask for a discount, a sliding scale, charity care, or a payment plan. Scripts that work. "I can't pay this balance in full. Can we discuss a hardship discount, payment plan, or eligibility for charity care? What documentation do you need from me to qualify?" Be prepared with basic financial info, income, household size, and recent pay stubs. Hospitals often prefer a guaranteed payment plan over extended unpaid balances and will work with you. If negotiation stalls, consider hiring a medical billing advocate. Sometimes a small fee to an expert yields larger savings. Section 3. Preventive habits and 3 final takeaways you can use right away. Preventive habits. Before non-emergency care, ask for a cost estimate and whether each expected provider is in-network. For planned procedures, request an itemized estimate and verify prior authorization. Keep a single folder, physical or digital, for medical bills and EOBs, and update it within 48 hours of care. That small habit prevents confusion later and gives you the paperwork you need if a dispute arises. Recap and takeaways. 3 actionable steps. Number 1, match dates and line items. Immediately compare the itemized bill to your EOB and your discharge paperwork. Flag any mismatches and request an itemized explanation. Number 2, document and escalate. Keep a call log, ask for reference numbers, and if initial calls don't resolve it, ask for a billing supervisor or patient advocate, and file a complaint with your state insurance regulator if needed. Number 3, negotiate and ask for help. Request discounts, payment plans, or charity care, and consider a billing advocate if the balance remains unreasonable. These 3 steps will let you act, not panic. They've helped the families I work with save thousands. If this episode helped you feel more confident about medical bills, please subscribe so you don't miss future episodes where we separate medical fact from fiction and break down the practical steps that matter. If you have a billing question you want us to cover, anonymized of course, send a note to the show and I'll consider it for a future episode. Thank you for listening. If today's episode helped clarify a medical or legal issue or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases. You can learn more or schedule a consultation at FAQbyNurseJessConsulting.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.